Hi, this is Dr. Garth Sliz, and this is the diagnosis of atrioventricular block. After analysis of the P wave and the QRS complex, we move on to the PR interval. If the depolarization from the SA node through the AV node is normal, it is normally delayed somewhat for ventricular filling, but if there is pathological delay in the AV node, then we can make the diagnosis of AV block. AV block is divided into first, second, and third degree AV block, and that all depends on whether the depolarization is being just slowed, inconsistently blocked, or completely blocked in the AV node. If we look at this ECG, we see upgoing P waves present in the inferior leads. We see narrow QRS complexes. And then we move on to the PR interval. We measure the PR interval from the beginning of the P wave to the QRS complex. And what we find here is that that measurement is consistent each time, but it is prolonged because normally the distance is 0.2 seconds or one large block, and we find that in this ECG it is longer than that. So with consistent PR intervals throughout, and a prolonged PR interval, we know that the depolarization is being delayed in the AV node, and it is being delayed consistently, so that gives us the diagnosis of first degree AV block. Now in second degree AV block, most of the depolarizations are getting through the AV node, but periodically one gets blocked completely. This happens with two different patterns, type 1 and type 2. Here we see an example of an ECG of type 1. And in type 1, second degree AV block, there's a steady lengthening of the PR interval until there is a P wave with no QRS complex. That is because in that instance, the depolarization was completely blocked in the AV node and did not proceed, and we see that best in this section of the ECG. And if we move it down a little farther, we see that it lengthens again until here again there is a P wave with no QRS complex, and the depolarization was obstructed again. Now if type 1 is a progressively longer PR interval before a dropped QRS complex, type 2 still has the dropped QRS complex, but instead of the progression, it has a steady PR interval leading up to the dropped complex. So the PRs stay the same, and then there is an unconducted AV beat. So if second degree AV block is an impaired progression of the depolarization through the AV node that eventually leads to a blocked depolarization and a dropped QRS complex, then third degree AV block is a complete block of the AV node so that no depolarizations get through. So what you see here in this ECG is two independent depolarizations. You're getting a consistent distance between the P waves and a consistent distance between the QRS complexes, but they are not connected. And two independent rhythms is third degree AV block.